is Largo, and my surgeon was Dr. Barrett.
And could you explain the diagnosis of your condition?
And I had some back problems and some knee problems, and then finally it generated into a hip problem. And so I had finally had some x-rays taken, and as soon as I saw that I needed a hip replacement, I knew there was only one place to come. My husband had come here 10 years ago and had such an incredible experience that I decided there's only one doctor to go to, and that's Dr. Barrett. So I made an appointment, waited a couple of months to get him because he's worth waiting for, and here I am.
How were you feeling before you had surgery? What was going on as far as your daily life?
Well, I had growing pain, and so I went to my family physician and we tried injections, and I'd had like 5 or 6 years of knee and back pain. So I had some injections and that didn't work, and I couldn't, I'm an avid gardener, welder, and other things, really active outdoors, ride horses, and I was always fatigued and this pain, and I couldn't walk, and it got quite bad. Mm-hmm. So that's when we upped the diagnosis process, and I ended up here.
When did you actually have the procedure done?
I had it done on the 15th of December.
Okay. How do you feel today? I know we talked briefly before, as you came in, today compared to before you had surgery.
It almost brings tears to my eyes, the difference. I never thought, I'm 67 years old, and I thought that this was part of the progression of just getting older, aches and pains. This procedure realigned my spine. I have no back pain. My knee, which was pain caused by the hip, is gone. I feel like I'm 40. I can work 6 to 8 hours of heavy work in the yard. I can do 6 hours straight of welding. I can park and not, I catch myself worrying about how close can I get. I no longer have to even think about that. I'm just so grateful.
How long was the recovery period when you had your surgery?
I had my surgery on a Monday and I was back to work on Sunday. And I walked up 3 flights of steps to get to my office on Sunday. Mm-hmm. I was on the pain medication for 2.5 days. And I was probably driving. I drove myself to the first week checkup. I was pleased with the medications that were provided me, the timing of the medications, but I think what aided in the recovery, and I'm not a person to go to workshops and those kinds of things, but was the preparatory class. And I'm not into those kinds of things, but that was very useful. I had everything ready at home, which I ended up really not needing, but it was there, so that I think gave me the security to really progress at a pretty nice rate.
Tell me what your experience was with your surgeon, Dr. Barrett, and his staff.
Well, Dr. Barrett has probably one of the finest reputations. I don't like to exaggerate the world, but and many times when you work with people of that caliber, they don't have any bedside manner. And he's an exceptional person. He has both. And his support staff are always on point, setting up appointments. They're very competent. But what I really liked was they seemed to care to a person, and they were so friendly and supportive. They cared.
That's how you feel about recommending ProLines Orthopedic Associates.
No problem, I already have. Dr. Barrett and Dr. Merritt are worth the wait.
Great.
Yeah.
Yes. Thank you so much.
Thank you.